Assalamu alaikum. I'm Dr. Ridwana Rahman, and today I'll be talking about the platelets. So by the end of this session, we'll be able to learn about the introduction to platelets, development, its morphology, the normal count, and also the functions of platelet. And we also will be know about the blood clotting factors and the hemostasis, which includes the vascular spasm and the platelet plug formation. So have you ever noticed whenever we bleed or whenever we cut ourselves, why does the bleeding occurs, and why and how the bleeding stops? Actually, you have seen or you have watched it carefully that the bleeding sometimes stops immediately. But how does it occur? So we will be finding the question's answer in this session. So in this slide, you can see the blood is flowing into the blood vessel, and whenever the blood flows in the blood vessel, it contains, we know the formed elements of our blood. We have three formed elements of our blood: the erythrocyte or the red blood cell, the white blood cells or the leukocytes, and the platelets. So today's topic is platelet. Platelet is one of the formed elements of our blood, and as we see that the platelet is one of the smallest formed element of our blood, it is also known as the thrombocytes, and the normal count of the platelet is about 1,50,000 to 3 lakhs per cubic millimeters of blood, and the platelets lives for around 8 to 12 days. The development of the platelets. The platelets arise from the bone marrow megakaryocyte giant cell. These megakaryocytes are actually 35 to 160 micrometers diameter cells, and these are the bone marrow stem cell. These are actually called the megakaryoblast. The platelets are formed from the megakaryoblast, and they give rise to megakaryocytes. And from the megakaryocyte, the platelet precursor extensions are formed, and from them the platelets are raised into the blood. Now these platelets are actually the spherical, colorless, oval or rod-shaped bodies which are around 2 to 4 micrometers in diameter. The Leishman stain stains the platelet into a faint blue cytoplasm with distinct reddish purple granules. In this picture, you can see that the platelet have a faint blue cytoplasm, and the organelles or cell which includes the platelet are the microtubules, dense tubules, surface connecting tubule, and there are some dense and alpha granules. The platelets also contain some mitochondria and glycogen. It contains mitochondria, microvesicles, microtubules, Golgi apparatus, and endoplasmic reticulum. The plasma membrane of the platelet contains the phospholipids, proteins, and on the surface there is glycoproteins. Within the platelet, there are some contractile elements which are called actomycin. These are the contractile proteins which causes the forceful contraction of the platelets whenever they are activated. The platelet also contain the thrombostenin, which is responsible for the clot retraction. The ATP, and histamine, adrenaline, 5-hydroxytryptamine, all these are also contained within the platelets. Platelets also contain the adenylyl cyclase AMP and prostaglandin. So what are the functions of platelet? The platelet is mainly concerned with hemostasis, and then it is also concerned with the blood coagulation, phagocytosis, and storage and transport of some substances. In this slide, you can see the peripheral blood film which focusing on the platelets. So you can see in comparison to RBC, platelets are very tiny dot-like cells. So before going into the process of hemostasis, we should know about the blood clotting factors. So there are about many blood clotting factors in our blood which are responsible for blood clotting, and we can categorize them into different numbers. Starting from factor 1, fibrinogen, factor 2, prothrombin, factor 3, tissue thromboplastin, factor 4, calcium ion, and factor 5 is procalcitonin or the labile factor. Factor 7, which is also known as serum prothrombin conversion factor. Factor 8 is known as antihemophilic factor A, and factor 9 is known as antihemophilic factor B. And you should know that due to deficiency of these two factors, the hemophilia A and B occurs. Then factor 10 is known as the Stewart factor. Factor 11 is known as the antihemophilic factor C. Then factor 12 is known as the Hedgeman factor. Factor 13 is known as the fibrin stabilizing factor, prekallikrein, and high molecular weight kininogen, and last but not the least, the platelets. Now we are moving forward to our next step, which is known as hemostasis. Hemostasis is one of the very crucial function of platelet, and it is composed of 4 sequential steps. And what is hemostasis? Hemostasis is nothing but it is the term which means the spontaneous arrest of bleeding whenever the small blood vessels are ruptured, and this is a physiological process. This hemostasis is composed of sequential 4 steps, which are the vascular constriction or the vascular spasm, formation of platelet plug, formation of blood clot as a result of blood coagulation, and last but not the least, the eventual growth of fibrous tissue into the blood clot, which close the vessel hole permanently. Now, step number 1, vascular constriction or vasospasm. This is a very crucial step, because whenever a blood vessel is cut or ruptured, the blood vessel in the end of the cut end of the blood vessel, they start contracting forcefully. This is known as the vascular spasm or vasoconstriction. Now, how does it occur? This constriction of the vessel occurs first and foremost to stop the bleeding spontaneously, and this results from the local myogenic spasm, the local autocrine factors which are released from the traumatized tissue, and platelets such as due to thromboxane A2, and it also occurs from the nervous reflexes. Now, in this slide, you can see the platelets. Whenever there is a cut in the blood vessel, the platelet suddenly rush to the site of the cut end of the blood vessel, and the platelets change their selves and they begin to assume irregular shape and form, and eventually they give rise to a cascade of phenomenon which is called the plug formation or platelet plug formation. So what happens in platelet plug formation? Whenever the platelets come in contact with the damaged vascular wall, especially the collagen, the platelets rapidly change themselves and changes drastically. They begin to swell, they assume irregular shape, and they became protruding numerous irritating pseudopods. And after becoming like this, they contract forcefully and release of some granules, and due to release of these granules, they become very sticky and they adhere to the collagen and the von Willebrand factor. The platelets secrete then large quantities of ADP and thromboxane A2, and thereby the thromboxane A2 and the platelet cause to activate more and more platelet. They drag and attract more and more platelet, activate them, and continue the process to occur. Look in this picture. Whenever the blood vessel is cut, the platelets suddenly rush to the site of the cut end of the blood vessel. They contract, they begin to swell, they radiate irradiating irregular pseudopods, they become very contractile, and they activate more and more platelets. They call for more help, and that is how the platelet covers the small hole of the blood vessel and stop the bleeding spontaneously. So this is the flow chart by which we can see that whenever there is injury, the platelets come in contact with the vessel wall and the collagen, and then the platelets adhesion occur. Platelet secretes more and more contractile elements, and then the platelets release ADP, thromboxane A2, and causes platelet aggregation, and ultimately there is a loose platelet plug is formed, which will eventually lead to rise a sticky and hard platelet plug. In this big picture, you can also see the similar events occurring sequentially. there's injury to the blood vessel, platelets come in contact with them, and release of substances, and ultimately platelet plug is formed. So this is for today now. Have a nice day. Allah Hafiz.